All right, let's get started. So good evening, everyone. Welcome to our webinar this evening, and thank you so much to everyone who's joined us. My name is Megan. I'm a future student advisor, and joining me tonight is Dr. Helen McCarthy, course chair and senior lecturer in dietetics at Victoria University. Tonight we're going to be discussing our Bachelor of Nutritional Science / Master of Dietetics. Just some background information on this course. It's a 4.5-year dual degree program. It is brand new. It will run for the first time in February 2021. It's currently in the process of getting accreditation from Dietetics Australia, which we'll tell you more about shortly. And we'll also go over the content that's covered in the course, as well as provide you with some information on the campus and the facilities, as well as the admissions criteria for this course. So once again, thank you so much for joining us, and I do hope you find this session helpful and informative. Just before we begin, I would like to do an acknowledgement of country and pay my respects to the traditional custodians of the land which we live, work and study on today. And I'd also like to pay my respects to the elders past, present and emerging. And I'll just go over a few housekeeping rules for tonight. Firstly, this presentation will be recorded for repurposing. All participants will receive a copy of the recording via email. Secondly, all attendees are muted and not visible, so none of the panelists can see or hear you. And finally, if you do have any questions throughout the presentation, please leave them in the Q&A box of this window, not the chat box, the Q&A box, please. And depending on the question, it might be answered live during the presentation, or you will receive a written response from our colleagues working behind the scenes. So we'll start with a bit of an introduction to the dietetics profession. So Helen, could you tell us a bit about the profession and what a dietitian actually does?
Okay, thanks very much, Megan. Welcome everybody. Dietitians are, as you can see from the screen there, scientists, educators, communicators. That's my definition of them. We are definitely scientists. As a dietitian, you learn a lot about how the body works and how it is affected by disease and how food nutrients that we need for growth, for health, and also to manage and prevent illnesses and diseases. But a lot of what we do is around educating and communicating that information. So we take all that science that we have, all that understanding of how to work with people, and we actually sit down and we talk to people on a day-to-day basis about how they can make healthy food choices for general health and well-being, but also to treat and manage and prevent certain diseases. So dietitians can work in hospitals, they can work in all sorts of places, but they're all doing essentially the same thing. They're helping people to make appropriate choices about what they're eating and drinking.
Wonderful. Thanks so much for that, Helen. We'll just touch on some of the highlights of studying this degree with us at Victoria University. These are just some of the many benefits of studying dietetics at VU outlined on the screen there. Can you tell us, Helen, a bit more about these highlights, or what else can students look forward to if they decide to study this course with us?
Okay, so working through what's on the list in front of you at the moment, dietetics is offered at a number of universities across Melbourne. All of those universities, with the exception of VU, are based in the eastern suburbs. So VU is the only university in the west that will actually offer a dietetics program as of next year. We're one of only 2 universities in the whole of Victoria that offer a bachelor entry program, which means that on leaving school, you can join the program, and in 4.5 years, you can exit with a master's degree in dietetics. Now, a dietetics qualification is to do a bachelor's degree and then apply to do a master's in dietetics, and that could take you anything from 5 years plus. So this particular course offers you a route in a much shorter time frame, just 4.5 years. We have a very innovative approach to teaching and assessment and learning, well, at least I think we do. And our current students that are studying with us in our Bachelor of Nutrition degree seem to enjoy what we do. We like to make things very real world. So we pull on real world scenarios. We work with partners, as you can see there, to provide opportunities for students to work on projects or do assignments that actually contribute to making a difference in bigger, wider world. And we've got particular examples of that in things like the third year of this degree. You'll have the opportunity to undertake what we call our community nutrition education program, where you actually work with real people, real groups of people delivering nutrition education and cooking skills. And you'll do that in the first semester of your third year of your studies. And you'll go on then to do more real world experience with your placements. But across the third and fourth years, you'll also have an opportunity to do a lot of simulated learning. So working with student speech therapists, speech pathologists, student nurses to actually simulate what it would be like to work in a real environment, so but in a nice, safe place, so that you actually get all the skills and knowledge you need before you're confronted with having to use them on real people. So we have a number of industry partners, and we'll talk a little bit more about some of those later on. These vary from healthcare providers to other organizations, sporting clubs, things like that. And we use them in different ways to meet our needs of the course, and to make sure that you've got all the skills that you need when you exit the course to actually practice as accredited practicing dietitians. Our campus facilities, we've got a couple of state-of-the-art facilities that we'll tell you a little bit more about later on. One of them is so state-of-the-art and so brand new that it only opened just as COVID was shutting everything down, so we haven't actually even been able to get into it properly yet. So that will be brand spanking new when we go into it next year. And of course the VU block model, which is unique to VU, and I think Megan is going to talk to you a little bit about that and explain a little bit more about that in a bit. But the other benefit of coming to study at dietetics at VU and is you get to be taught by me, because I think that I'm so excited about what I do. I'm so excited about the opportunity we've got to have dietetics here at VU. And I hope that I can share some of that excitement and some of that passion for dietetics with you while you're learning.
Fantastic, thanks Helen. Yeah, enthusiastic educators is another massive benefit of studying this course.
Absolutely.
So, as Helen mentioned before, one of the biggest benefits of studying at Victoria University is our block model. So for those of you that haven't heard of it, the block model refers to the way we have structured our degree program so that you study only one subject at a time, as opposed to 4 subjects at a time like at other universities. Some of the benefits of our block model: firstly, your transition to uni will be a lot easier. So when you first start university, it can be pretty daunting to make that transition, and having to juggle the demands for 4 different units at the same time, that can only make you feel even more overwhelmed. But with VU's block model, because you only need to focus on one subject at a time, this actually makes the transition a lot easier for you, which will help to set you up for success and build confidence in your studies. You'll also feel more supported with the block model, as we have smaller class sizes than other universities, and that means that you get more one-on-one time with your teachers. It also means that the classes are more interactive and it's easier to collaborate and have discussions with your teacher, as well as your classmates. And most importantly, you'll feel less stress with the block model, and less stress means more success. So instead of stressing out over the 4 subjects and worrying how you're going to fit the demands of all these subjects into your schedule, you just need to focus on the one subject, which will help you to get better grades. It also increases your chances of overall success in your studies. If you're interested in the subject you're enrolled in, you can completely immerse yourself in it and enjoy all that unit has to offer without the distractions of the other units that you need to study. And if you don't enjoy that particular subject, well, it's over in 4 weeks. You don't need to wait 6 months to finish that unit and receive your results like you do at other universities. And now I'm just going to play a short video for you. This is just a basic summary of the block model in 60 seconds.
We've been teaching the same way for hundreds of years now, but the world around us has changed, and along with it, employer and industry needs. So at VU, we change the way you learn with our Australian first block model. Traditionally, you juggle the demands and deadlines of 4 units at once. Instead, the VU block model has you focus on 1 unit at a time. Each year will be broken into 2 semesters. Each semester will be broken into 4 blocks, which run for 4 weeks. You focus on 1 unit in each block, completing all your assessments before moving on to the next. So, instead of this, VU's block model looks like this. The block model offers you flexible study options, support from 1 teacher per unit, and practical hands-on teaching methods that prepare you for your future. So when you study at VU, you know you'll gain the support and skills you need to succeed.
Hope you all enjoyed that short film. We're just going to look at the what's covered in this course, so the actual course structure and what is covered in this degree. These are the units that students will study in the first 2 years of the program, which has a huge focus on nutrition. Helen, can you tell us a bit more about what students can expect to learn in the first 2 years of this program? Sorry, Helen, I don't think your audio is working.
Sorry, try that.
That's better.
Sorry. So in the first 2 years, this is the bulk of the undergraduate part, so the bulk of the Bachelor of Nutritional Science. And for anybody that's looked at the Bachelor of Human Nutrition that we currently run, you'll notice maybe some similarities here. And I can see that there's a question in the Q&A about the difference between the courses. So I will touch on that a little bit once I've finished talking about the structure, as I go through the structure of the dietetics program. So the first year of the 2 programs is both exactly the same. The reason for this is because they are basic underpinning sciences and skills and knowledge that everybody needs, whether they're going to be a dietitian or a nutritionist. So we're looking at communication skills, we're looking at basics of sort of human physiology, biology type skills, we're looking at chemistry type skills, because again, we need those to understand how the body works and how food works in the body. And then we have 3 specific units around nutrition, so nutrition, communication and society, that explores how society and how people relate to food. We've got food components, which is an introduction to how food changes when you harvest it, when you process it, when you cook it, and when you eat it. And then we've got introduction to human nutrition and food, which focuses very, very specifically on what are the nutritional requirements of people in Australia, what are the guidelines that we work by to actually meet those requirements. And then moving on into the second year, this is where the 2 courses diverge. So there are still some units that are in common, but there are also some units that are very different. So within the dietetics program, you have no choices in units. You have to do the specific units that are included in the course. Within the Bachelor of Human Nutrition, we do offer, we have core units, and then we offer options of certain minors, which are groups of 4 units that you can take in certain areas of specialization. Now, some of those units are included in the dietetics program, but you don't have choices in the dietetics program. There are certain boxes we have to tick, so you have to study certain things to achieve that, and it doesn't leave an awful lot of room for anything else. So in the second year, we go on to study some more science. So pathophysiology 1 and 2, one in semester 1, one in semester 2. This looks at how the body changes, what changes and how it responds to diseases and illnesses, the impact that they have on the body, and how medicines and lifestyle changes can actually affect those changes and either reduce the impact of them or create a stall for the diseases getting worse. So we have pathophysiology 1 and 2. You've also got medical biochemistry and exercise biochemistry. These again are looking specifically at how your body reacts to changes in disease states. So within these units, you'll explore how the body changes when it's got things like cardiovascular disease, when it's got things like type 1 and type 2 diabetes. How does cancer actually affect what is happening in your body and how your body works? So those 4 units are vital to the work that a dietitian does, that it underpins their understanding of where nutrition fits into preventing and treating people with illnesses and diseases. But alongside those, we've got some core nutrition knowledge units to actually expand your understanding of nutrition. So family health and nutrition through the lifespan looks at nutrition from preconception right through to older age, looks at what the requirements are, looks at how just the simple process of aging changes those requirements over the lifespan. And it also looks at factors such as how food choice is affected by your age and your background. Properties of food is a continuation of food components that you would have done in the first year, and it looks, well, I describe it as kitchen chemistry, and the food scientists that teach it get very cross with me for doing that, but that's how I understand it. Basically, it's the science, a bit more about the science of food. So it breaks down the specific components of what's in food to look at how they can be modified for improving health, how they can be modified for improving taste, appearance, smell, all the things that affect whether you like or don't like eating something. And within that unit, we do have you in the kitchens doing some basic kitchen chemistry, as I refer to it as, and we also have you in our state-of-the-art brand new sensory suite, which is on the Footscray Nicholson campus, and we'll talk about that a bit later, but that allows you to understand the factors that affect what makes food appealing to people and what makes it horrible to people. In the semester 2, in year 2, you look also at diet and disease. So here we start looking at the role diet plays in disease prevention, and how diet can be changed to actually reduce the risk of a lot of the chronic diseases, the role it plays in the development of things like mental health problems, as well as cardiovascular disease, and type 2 diabetes, but also intestinal diseases, as I've already mentioned, mental health, and we look at, and bone diseases, and we look at how diet can be used to prevent these diseases that are very common in our society from actually developing. And then our final nutrition unit in this cohort, in this block, is sports and exercise nutrition. This is a relatively new addition to our suite of nutrition units, but a lot of people that are interested in dietetics are also interested in going on and doing sports dietetics, which is a potential career outcome. And this introduces you to the basics of sports nutrition. So if you think that that's what you might be interested in doing, this unit will allow you to do that. In this second year, all these units are options. The family health, properties of food, diet and disease are all core units to the Bachelor of Human Nutrition as well. So students will also be taking those. But the other students are options as part of the minor in the Bachelor of Human Nutrition. And when we get on a bit, I'll explain to you why that's why we've got this similarity and why we've got this overlap.
Wonderful. Thanks so much, Helen. Moving on to the middle part of the course, which is year 3 and the first half, where are we? The first half of year 4. So the focus shifts here from nutrition more to the dietetics specific units. There's also one placement unit outlined here at the end of semester 3, year 3, semester 1, nutrition, communication and education. Helen, could you tell us a bit more about what's covered in this part of the degree and more about that placement unit?
Yep. Okay, so year 3, semester 1, this is where you're still doing some units that have common links with the Bachelor of Human Nutrition. So again, because we know a lot of dietitians want to go on and work in either public health or in health promotion, or in the area of sports and exercise nutrition, we have the exercise interventions for healthy populations. And this teaches you about how to assess somebody's exercise tolerance, what they can and can't do, and also how to encourage them to increase their exercise levels. And having worked as a dietitian myself for a long time before I became an academic, talking to people about the whole lifestyle and how their diet fits into that is something that you do quite often. So you're often talking to them about their beliefs and thoughts around food and around their health and around the way they live, but you're also often talking to them about how they can actually increase their exercise levels and what's good exercise for them and what's not. And things you'll learn in this unit are things like the fact that one of the most effective interventions for preventing high blood pressure, and high blood pressure is one of the big factors that lead to illness and death in the Australian population, is simply walking. And that's one of the things that you'll learn in this unit, and you'll learn about how much walking and the type of walking, because believe it or not, there are different types of walking. The other units, you then have the health promotion unit. This teaches you about the basics of how to promote health, how to think about designing and delivering interventions or strategies or activities that can change people's thoughts and beliefs and ways of living to a more healthy way. And diet is a key part of that, and dietitians work in the area of health promotion, so this is why this unit is important in the dietetics program. That unit and the exercise interventions are both options in the nutrition program. We've then got the evidence-based practice for health professionals. This one nutrition students don't do, it's just the dietetics students do this, and this is to set you up for some of the content when we get into the second half of third year, which is dietetic specific. This is where we start talking about, as a health professional, how do you know what is the right information to give people? When do you need to change guidelines and advice on what is healthy to eat and what is not? Because I'm quite sure you've all seen in the newspapers and on social media, one day chocolate's good for you, the next day it's bad for you. One day coffee's good for you, the next day it's bad for you. So this evidence-based practice unit actually teaches you how to discriminate between the two. We do touch on it in other places in the course, but this one is specifically focusing on how you do it as a dietitian. And then the final unit in semester 1 is the nutrition communication education. This is the placement unit, as Megan mentioned. This is the unit that gets you into our purpose-built community kitchens on the Werribee campus, where you will be working with groups of community groups, so groups of real people from the community, to teach them about healthy eating, about healthy lifestyles, about cooking skills, about shopping for healthy food choices on a budget, and basically you'll be working with a group of students under the supervision of a member of the teaching team to deliver a 4-week education program to real people in the community. So you're actually doing a job at that stage. Then when you move into semester 2, this is where we get into the master's component and the dietetic specific units. So the focus moves away now from things that are generic across nutrition professions as a whole to things that are specific that dietitians need to know. So things like, how do you communicate professionally and motivate people to change their behavior on a one-to-one basis? How do you treat diseases with diet? So type 2 diabetes, type 1 diabetes, cardiovascular disease, cancers, inflammatory bowel diseases, other gastrointestinal diseases. What happens when somebody has major trauma? So a head injury from falling off a ladder or being in a road traffic accident. How does nutrition play a role in that? How do you work out what you need to feed the person, and how do you feed a person when they're unconscious? So these are the kinds of things that you start to deal with as you go into the second part of the third year and the first part of the fourth year. It's all specific to how do you treat sick people. And as also mentioned, a lot of the other two areas that dietitians predominantly work in is public health. So we have a specific focus on public health nutrition, and the final area that a lot of dietitians work in is food service. So things like Meals on Wheels, food service, food provision for early years, food provision for aged care, food provision for hospitals, and the food service systems and management teaches you the theory around that. We also want you to understand a little bit about research, and that's because in the final part of the degree you're going to do a research project, so we teach you research planning and statistics in this block as well.
Fantastic. Thanks so much for that, Helen. Finally, moving on to the final part of the degree, which is the first half of year 4 and the last semester, which is in year 5. Helen, can you tell us a bit more about what the master's component of this course entails, and a bit more about the placement units in this part of the degree?
Okay, so these last 2 semesters are purely placement-based units. So this is like the icing on the top of the cake. You've done all the hard work, you've done all the learning, and now you get to actually put it into practice. So for some people, this is absolutely terrifying, but I say for most people, it's the icing on the cake. It's what you've spent all your years studying up to that point to actually be able to do, to get out into the workplace and do the job. So there are 3 dietetic specific placements that you'll undertake of different durations. So, and you'll not necessarily take them in the order that you can see them here on the screen. The order will be rotated depending on where we have placements at the particular time. So some students may be starting with the medical nutrition therapy placement. Some students may start with a food service placement. Some students may go straight into their research project. So these will move around depending on the groups and the excuse me a second. Oh wait, I'm working. Sorry, these will rotate around depending on the order in which you're assigned to do them as a student. But basically, there's the 3 dietetic placements, and then there's a research project placement. So as a dietetic student placement, you've got medical nutritional therapy, which is either in a hospital or in a community clinic setting where you would be working on a one-to-one basis with patients that have got diagnoses such as inflammatory bowel disease, such as Crohn's disease, or ulcerative colitis. You might be working with people with type 1 diabetes. You might be working with people with different types of cancer, but you're working on a one-to-one, giving them dietary advice to try and reduce their symptoms, improve their quality of life, and in some cases actually treat the disease completely, so make it go away. The food service placement, this is about understanding how the food gets the patient, because as a dietitian, you're very reliant, wherever you work, on somebody else providing the food to the person that you're talking to. And that person is maybe an aged care person, maybe a sick person in a hospital, but you need to understand about the food and how it gets to them. And a lot of dietitians actually specialize in food service, and they work in this area. And in this area, what you do is you're about planning specific menus to meet the nutritional requirements of individuals. You're about adjusting the texture of the food, the quantities of the food, maybe fortifying the food, adding extra things to it to make it more nutritious because somebody can only eat small amounts. But all of that comes into the food service side of things. The community and public health nutrition placement. This builds on the stuff that you've already studied, like health promotion, like the community education unit that you would have done in your third year. And this allows you to go in and to community organizations and health organizations in the community, such as CoHealth or IPC, who we do have relationships with. And with these organizations, you undertake some kind of project or intervention. So this might be working with, you could also be working with somebody like Western Bulldogs, who we have links with, but it could be going into Western Bulldogs and helping them run their Sons and Daughters of the West program, which is about educating members of the public on healthy eating, healthy lifestyles with activity, and looking after their emotional and mental health as well. So you could be working in those programs, helping to deliver them, helping to evaluate them to make sure that they're working, that they're doing what they're set out to do. And then the final unit in this block of 4 is the research project. This you could be doing absolutely anywhere. So you could be doing it on the VU campus, you could be doing it alongside dietitians in places like Western Health, you could be doing it alongside the sports dietitian at Western Bulldogs, you could, but basically this is a project that allows you to gather information and look into a particular question and try and find the answer for it alongside experts in that area.
Thanks so much for that, Helen. Another question we do get quite a lot is, do students have to find the placement themselves?
Absolutely not. We will source all your placements for you, and we do that through relationships with clinical and industry partners, where we actually build the relationships beforehand and develop the placements, because with dietetics, what you're assessed on at the point of graduation is, do you meet the competency standards that are set nationally by the Dietitians Australia. And so we will be working with your placement partner, with our placement partners, to make sure that they can deliver placements that allow you to show us that you do meet those competencies and you can do the things that you need to be able to do as a graduating dietitian. I've just seen, do you get straight into the master's doing the bachelor or the prerequisites? We can answer that one in a minute.
Definitely. And moving on to industry connections. Yeah, so as you see here, we have quite a few industry connections at VU that help us to ensure our courses are not only up to date, but designed with the latest expertise and technology. It also allows our students to build connections with industry representatives, and it allows us to arrange internships and work placements for students, where you put the work you've done in the classroom into practice. Helen, you've already told us quite a bit about placement. Is there anything else, any other opportunities with our industry partners that the students should know about?
There are always volunteering opportunities as well, which we actively encourage the students to get involved with volunteering. So people like Food Bank, people like the Stephanie Alexander Kitchen Gardens, which run in the primary schools local to the university, to get involved with volunteering with that, because it builds your skills around communicating with people, understanding how people relate to food, how they think about food, how they access food. Western Health also have a volunteer program that works with patients around their meal times. This again, an excellent opportunity to get an insight into how the meal system is organized in a hospital and what patients in hospital actually think of the food that's offered to them, which sometimes isn't too complimentary, but it's a good opportunity for you to appreciate that, because as a dietitian, you're going to be working with those resources in the future.
Fantastic. And yeah, on that note of placement and industry partners, let's talk a bit about the career opportunities after graduating from this course. So yeah, as mentioned earlier, the course is brand new. It will run for the first time in 2021. So we're currently still in the process of seeking accreditation for the course from Dietetics Australia, which we've got more information about on our website. So after graduating as a dietitian, there's many areas you can work in. These are just some of them outlined on this page. Helen, are there any other career opportunities that might be available to students after completing this course? And can you tell us more about when it's most likely to be accredited?
Okay, if we start with the accreditation process is such that to be able to offer a degree in dietetics in Australia, you need to have received program qualification from Dietitians Australia. So, which means that you have to present them with your program, the partners you're going to be working with, the units of study that the students are going to be taking. So basically they look over everything that you're doing, and they look at how you think that's going to map to and relate to the competencies that I've already mentioned that new graduates have to demonstrate that they meet. So that's the first stage. So we have that now, which is why we can recruit to the course in 2021. Yay! But from that stage, the process for accreditation of dietetics programs is that 12 months prior to the first cohort of students graduating, the university will submit an application for provisional accreditation. So from a student point of view, this means that at some point they might come along and they might like to sit down with some of you and talk to you about how you found the course, what you've learned, what your expectations were, have they been met, and how things are going. And at that stage you'll be in placements, so what your placements are like and what you're learning in there. From a staff point of view, it's a little bit more involved. We have a lot of paperwork to produce. We have a lot of evidence to gather to show that as graduates you will meet the competencies that they have set out. So at the point of graduation, for the first cohort, the program we would hope would have provisional accreditation. Provisional accreditation means that you as graduates are eligible to apply to the Accredited Practicing Dietitians program with Dietitians Australia. You're allowed to call yourself an accredited practicing dietitian, and as such you're allowed to see patients that will fund their dietetic care through Medicare or the Veterans program. So as I say, we have no guarantees that we will get accreditation, but we're hopeful because they have seen everything we are proposing to do at this stage, and other programs that have gone through this in the recent past have been granted accreditation, provisional accreditation at the point that they've applied for it. The subsequent to that, once we have a first cohort of graduates, we can apply for full accreditation of the program, which will be, if granted, is in place. Again, a lot more paperwork from the staff point of view, not very much input from the students, but once we have full accreditation, the course is accredited for 5 years. It has to provide a report every year on what it's doing. It has to provide a report every time it changes the spelling of something in one of the units. So it's a very strict process, very fastidious process, but it does mean that if you graduate from an accredited program, you are of the highest quality, and that is what we would be aiming for anyway. Talking about employment opportunities, which was the other question Megan asked. Private clinics, yes. Hospitals, health promotion, healthcare, so you can work as a dietitian in a hospital. You can go into research positions. You can also go into sports dietitian, dietetics positions. So there is a past VU graduate that is currently the dietitian for the Western Bulldogs and is living it up in Queensland at the moment, because she does some teaching for us already, and we would be hoping that she would do some more when we as we progress through the dietetics program. Within every area, you can also specialize. So for example, I worked in hospitals as a dietitian when I qualified, but my interest was with working with children. So I specialized as a pediatric dietitian. So I work with children, everything from premature babies that would fit in the palm of your hand, right through to strapping great 18-year-olds that were about to transfer to adult services, but that had had cancer or had conditions like cystic fibrosis or type 1 diabetes.
Fantastic. Thanks so much, Helen. And moving on to the facilities and the location of the course. So the majority of the workshops and classes take place at our Footscray Park campus. And there's also a lot of practical work involved in the course, which some of which is undertaken at the Sunshine Clinical School. As Helen said before, brand new facility that opened in March this year. Could you tell us, Helen, a bit more about these facilities and what students will get to use at the campus?
Okay, so the Footscray Park campus, we have a lot of our teaching rooms there. They are set up with a lot of interactive technology because the block encourages the block design, which, to answer one of the questions in the Q&A, for most of the units, it's 3 hours per workshop, 3 days a week. Some of the units have additional hours, so that's 9 hours per week for a block. Then you also have additional labs and things like that that are picked up and may require extra hours. The placements are full-time, so that's the one thing I would say at this point. All the placements are full-time, 9 to 5 or 8:30 to 4:30, 5 days a week for the duration of the placement. So Footscray Park has got a lot of interesting rooms designed in different ways, PC rooms and things like that, and we use the correct teaching room for the units that you're studying. So if you're doing something that requires a lot of PC work, you'll be in a PC lab room. If you're doing something that requires physiology labs, we've got purpose-built physiology labs on the Footscray Park campus. St. Albans Clinical School, this is brand new building that has opened at the beginning of this year, as I say, and we've barely got into it. And it's a multi-professional space. So nurses are in there, osteo is in there, physio is in there, speech is in there. And within that space, we have simulation suites. So these are sort of mock-ups of real wards or real outpatient areas, or in some cases, real homes, real like living rooms, so you can actually practice your skills of talking to patients and working with patients in a number of different environments before you actually get into that environment for real, with real patients in front of you.
Fantastic. And apart from those two facilities, we've also got the food sensory lab at Footscray Nicholson campus, as well as the community kitchen at Werribee campus. Could you tell us a bit about those as well, Helen?
Yep, the food sensory lab is at Footscray Nicholson. You will be in Footscray Nicholson for because they've also got some good kitchen facilities there that we use for properties of food unit. So within that particular unit, you'll get experience in the kitchen, but you'll also get experience in the food sensory lab, which is a room with lots of little booths in it. And very specified lighting and heating, so that we can test out how changing a recipe or changing the look or changing the texture of a food actually affects what it tastes like and how acceptable it is to people. And you'll do some practical exercises in that within the second year of the degree. The Werribee campus, we have our community kitchen. This is specifically designed to allow us to educate the groups, community groups coming in. So we've got a teaching room and we've got the kitchen, so we can deliver some education about what is healthy eating, how to make healthy food choices, and then we can bring our client groups into the kitchen, and they get to cook basic dishes with the support of students. And this unit's already running, and in the past few years we've had community groups coming from places like Sunshine Special Development School, from co-health residential services, from organizations like YMCA Disability, and they bring a range of clients to us for these educations, and they come back year on year to actually, and a lot of the clients come back year on year because they have so much fun learning cooking skills and learning about healthy food choices, and then sharing that knowledge with everybody that they know.
Wonderful. Thanks for that, Helen. We have run over time, so I'm just going to get through the last few slides as quick as I can. We're just going to touch on the admissions criteria for this course. So if you're a Year 12 student and you've recently completed Year 12, firstly, there will be an ATAR required for this course. However, as it's a brand new course, the ATAR has not yet been confirmed. If you're in Year 12 and participating in sport, whether it's as a player, a coach or an official, you might be eligible for an ATAR adjustment through our Elite Athlete program, which is a separate application you can submit after applying for this actual course. We do have further details about this on our website, or if you'd like further information about the program, please feel free to reach out to us and we'll discuss it with you further. Apart from the ATAR, you also need to complete units 3 and 4 as part of your VCE and achieve a study score of at least 30 in EAL English or 25 in any other English. You also need a study score of at least 25 in 2 of either biology, chemistry, physics, health and human development, any mathematics or physical education. For applicants that have recently completed VET or higher education studies, you might be considered for this course if you've completed a diploma or advanced diploma in health or human sciences. If you've completed at least 2 semesters, which is 1 year, of a degree in health or human sciences, or if you already hold a degree, a completed degree in any discipline, you're also welcome to apply for first year entry. With regards to second year entry, in order to be considered, you will need to complete at least 2 semesters of our Bachelor of Human Nutrition. Places are limited for both first and second year, so you will be ranked according to your weighted average mark in the first 2 semesters of study. Helen, could you tell us a bit about why the places are limited and why the course is in such high demand?
Okay, so dietetics as a course is in high demand across the whole of Melbourne. In fact, across the whole of Australia, and because of my international connections, I know it's also in high demand in other countries too. So the course itself, but because of the placement requirements, because these placements are very intense, they take a lot of time and commitment from the clinicians to actually supervise the students on the patients. Numbers have to be limited to what can be provided at the placement end of the course. So we don't anticipate having huge numbers into the course. We are looking to take maybe around 20 students into the first cohort, 20 to 25 students into the first cohort now in 2021. And then if somebody doesn't meet the ATAR requirements to get into the combined degree, if they do the Bachelor of Human Nutrition, again, because of needing to limit the places, we're looking to restrict the number that transfer at the end of first year. So that will be possibly around 5, but say 5 or 6 students that we would be looking to transfer between courses at that stage.
Wonderful. And finally, we're just going to touch on the application process for this course. So all applications for the course must be made through VTAC. That's vtac.edu.au. Applications for our February 2021 intake are open now. They will close on the 30th of September. At this stage, there's only one yearly intake for this course, which is February, so there won't be a mid-year intake for this course at the moment. However, if that changes in the future, our website will definitely be updated to reflect this. That's one of the many benefits of the block model, is that it does allow us to have multiple intakes per year. And that brings us to the end of the presentation. So thank you so much for everyone who tuned in tonight. If you haven't done so already and you do have any questions, please leave them in the Q&A box. We'll have your questions answered before we all log off. As I mentioned earlier, anyone who registered for this webinar will receive a copy of the recording via email, hopefully tomorrow or the day after. Make sure you check your emails and check your junk mail folder as well. Our contact details are in the email if you want to reach out to us for further information. If you have no further questions, feel free to log off now. Again, thanks so much for tuning in, and we do hope you enjoyed tonight's session, and hopefully you managed to get some of the information you're looking for. Just regarding a couple of questions that have come in, Helen, could you tell us, apart from being a dietitian at the end of this course, how is it different to the human nutrition course? What are the benefits of doing this course with the masters over choosing the human nutrition course and when students get into the workplace?
Okay, so essentially a dietitian can do everything that a nutrition graduate can do, with the addition of working with sick people. That's the simple version of it. The advantages are that the dietetics is much more vocationally orientated. There is a clear career path outcome, as in you will be eligible to be an accredited practicing dietitian, given that we get the accreditation in place. So you will be eligible to be an APD, which will allow you to work in the clinical environment. Nutrition graduates can do much of the same roles in terms of the public health promotion side of things, but they cannot work in the clinical setting. Nutrition graduates can go into food service if they have an interest in that, and they can also go into sports nutrition. But sports nutrition within Australia are predominantly around dietetics. So the majority of elite clubs employ sports accredited dietitians rather than nutritionists, but a lot of nutritionists can work alongside them or under them as in that field. But yeah, a lot of nutritionists struggle to get jobs in sport if that's what they're interested in, particularly in Australia. And then but the public health and the health promotion side of things is definitely where nutritionists excel. You've also, for both careers, you've got the options of media, and health media, which is an increasingly popular career direction now for a lot of dietitians and nutritionists.
Wonderful, thanks Helen. We have another student asking, can you get straight into the Masters of Dietetics, the Masters component of this course by doing the Bachelor, or what are the prerequisites for the graduate entry component?
Okay, so we will have the graduate entry route, so there will be a route into the Masters component, so the last 2 years of this program. If you have successfully completed the Bachelor of Human Nutrition with the right minor choices. So you have to take, within that program, we have a minor called Biomedical Nutrition, which covers the pathophysiology and the biochemistry units that I mentioned. And you would be required to take that minor to be eligible to apply for the Dietetics Masters. Again, places will be severely limited because we are working with the same placement providers as we are for the combined degree. So it will be competitive applicants to actually get a place on that master's course as well.
Great, thanks so much for that, Helen. Let me just check. I think we have another question about a degree in sport technology. Just, I suppose the student's asking if that will meet the entry requirements for this course. And it's from the UK as well.
Yeah. For the I would say that that possibly needs to go to Kylie, but for a clearer answer. But I believe there is criteria around the what's the word? The currency of your degrees for being able to apply for things. And because we're only applying through VTAC, we're only taking applicants through VTAC this year. I don't know if that would work, but maybe Kylie could pick it up.
I'm happy to jump in. Hi, Jane. I was trying to private message you. I'm happy to take, I don't know, Kate, if you've got Jane's details. Usually what we do with overseas qualifications is we assess them for equivalence to Australian standards to see if we meet the admission criteria under the vet or higher ed category. I'm more than happy to have a chat with Jane offline if we can get your details and have a little bit more information about that qualification to give you a better sense. Your application would still need to go through VTAC, but I'm happy to give you some guidance around that, Kate, if we can, or Megan, if we can get Jane's details offline.
Thanks, Kylie.
Absolutely. That's all we have time for at the moment, but we will actually, as I mentioned before, we will be sending you all a copy of this presentation via email, hopefully tomorrow or the day after. That does have our contact details in the email as well. If anyone's interested, tomorrow I'm also doing a webinar on another one of our dual degrees, which is the Bachelor of Speech and Language Sciences / Master of Speech Pathology. Same time tomorrow night. You can find it on the events page of our website where you found this one. And yeah, that's all we have time for tonight. So thank you so much to everyone who tuned in. Thank you so much, Helen, for your advice and your information that you were able to provide tonight. And yeah, we look forward to receiving your application soon.
Yep, thank you very much.
Thanks, everyone. Have a great night.